podcast. Today we have here Deborah Boley. She is the founder of the Plain Language group. Deborah, could you introduce yourself and share a little bit more about yourself and about what you do?
Sure, happy to. Thank you. Thank you for inviting me here today. As you mentioned, I'm the founder and principal of the Plain Language Group, which I started 20 years ago while I was a tenured professor at UNC Charlotte in the United States. I was teaching technical writing, and plain language just started to be in the air. And of course, I was very attracted to it because I was already teaching engineering students, computer science students, how to write in a manner that non-experts could understand. So it was very easy to make the move. And the Plain Language Group, as I mentioned, we've been in existence for 20 years. We work primarily with financial, technology, healthcare, government agencies, corporations, etc. So the three or four sectors we work in. Companies we work with are usually Fortune 500, 1,000. I am actually right now working with the CDC, so we've had experience in the health area as well. And our mission is that we believe people have a right to understand information that affects their lives. And particularly in the health field where you're literally talking about life or death, depending on people understanding. So that's enough about me.
Thanks so much. Yeah, definitely. Yeah, the access to health information, to the access to health information plays a critical role, right, in the health of the people.
Very.
And it's the whole in the plain language it's inside that the whole field of the health literacy, right? We work hard to boost health literacy and to that because there is a huge correlation, right, of the whole health literacy to health outcomes.
Yes, absolutely. Yes. Well,
Go
the
ahead.
National Institute of Health, the NIH, they have been committed to plain language for well over 2 decades. So, but it has not seeped down to our local hospitals or our local physicians. So I think there's much more work to do in the health sphere, definitely.
Yeah, so I think we continue on. I think maybe today we have, I think, increasingly more awareness, right, about the importance of the
Yeah.
health literacy. I think I can hear more conversations about that. But I think we definitely we are just in the beginning of that journey. I think we still have a long road to go.
Yes, we do. We've been in the beginning for a long time, but
Yeah, I imagine.
it's getting a lot. Now, when I say the words plain language to people, they actually have an idea of what that means. So that's progress right there.
Yeah, I can imagine. I can imagine. So, what prompted your interest in plain language?
I'm sorry.
Like, what prompted your interest in the plain language space?
Well, as I said, because I was teaching technical writing and I heard about the word, I don't know, I can't exactly explain, like at this moment, I heard about plain language, but it seemed to be in the air, and as I said, it appealed to me because I was already teaching students how to do some of what we would consider to be plain language because they had to learn to write for non-experts.
Mm.
So then I remember going to Washington when the Center for Plain Language began in the early 2000s, and that's where I heard a number of speakers, Jenny Reddish, Karen Shriver, Joe Kimball, a number of speakers in multiple areas talk about plain language. And then I just said, this is the path that I want to be on. And so I started the Plain Language Group as an official company rather than my just doing the work as a consultant, as a faculty person. So, and I've never looked back. I have never regretted ever forever taking this path. I think it's important work. And the longer I'm in the plain language space, this makes me very happy, I see a lot of younger people moving into this space as well. So I think, the whole field of plain language has expanded internationally. Certainly not just, we're behind some other countries, but and again, in technology, health, and finance, where I tend to do the most work, I have seen actually quite a bit of progress. And then in 2010, with the Plain Writing Act requiring federal agencies to use plain language to talk about benefits and services, it's just gotten to be, as I said, I don't have to explain to people what plain language means. And in fact, they usually say, oh, thank you for doing that work for all of us. So.
Yeah. And I think today the understanding of a plain language, it is easier. And it's like, it's more than just a short sentence. It's more than just a simple words, right?
Yes. And design is a factor in it as well. Of course, it's not only words, it's also how information looks. Does it look easy to understand? So, we talk a lot about the use of visuals, but mostly it just simply comes down to, have you written this content so that it's easy for people to understand it? That's what we do.
Yeah, absolutely. And I think, especially as we wanted to, I think like for healthcare professionals, for healthcare organizations, on the side of healthcare professionals and healthcare organizations that wants to promote more health and educate the public, the patients about disease, about their chronic conditions, all that, as you need to make it easier for them. And to have that easy access to the information where they can find it without that complexity. Because I think, like you said, we're still kind of like in the beginning in some fashion. Because even though I think in my experience in healthcare, even though I think that there are more simple information for patients today about health conditions, there are other things today that I still find some complexity on how healthcare professionals communicate. There are few things like, I think we talked before we got in the podcast, like when we are, like I said, I had the experience before, had a surgery, had a procedure, and I went to read the notes of the surgery, all that. And there are a bunch of complex medical terms there. And hey, even though I'm educated, I have a master's degree, all that, let me check here what these words mean. It's not easy. It's that some of the vocabulary of the words that they use, few times of the what healthcare professionals is, and it's like, okay, so let me try find. And so you imagine how so many more patients is in the vast United States struggle, right, with the whole, if you're looking into the educational level, right, of the people.
Yeah, well, I think unfortunately, like a lot of areas, I think health professionals tend to write or speak for each other, not for us. So, for example, I was in an ophthalmologist's office not too long ago, and they were checking my eyes, my annual checkup. And the technician said to me, how well do you see when your eyes are in a superior position? And it annoyed me. So I said, well, if my eyes were superior, I wouldn't be sitting here in this office. And then she laughed, and I said, I just want you to know, I have a PhD. I have no idea what you just asked me. And she said, just how well do you see when you look up? And I said, normal people who are not in your profession would understand how well do you see when you look up, but did not know when you said how well do you see when your eyes are in a superior position. So they get so used to speaking their own language that they forget that they're not speaking to themselves or to people like themselves. And most, like when I go on my online portal to look at the test results or the doctor's notes, sometimes I can read. but test results, I have no idea what
Yeah,
they're
that's all the one.
right. Is this good? Do I have a problem? Blah, blah. So, and I think the thing that, you and I can talk about this, and people listening to this podcast have all had those experiences. But I think the part of the problem is they're not taught how to speak to patients in med school the way I think they should be taught.
Yeah.
They're taught how to communicate in general, but not to put that language aside. Or another time I had sprained my ankle or something, and they said, well, are you ambulatory? And I said, no, my husband brought me here. Well, they meant, can you walk? But
Yeah.
ambulatory to me immediately evoked, was I in an ambulance or not? So I think we still have a lot of work to do, but I just try to remind healthcare workers that they're speaking to someone who doesn't speak their language.
Yeah,
That's
yeah.
kind of the way I talk about it.
Yeah, I think, I think most importantly, especially when you want the patient to make a decision about what's about the procedure, or about the care treatment. It's like, okay, if you don't make the language simple, it's becoming hard for the patient to make that decision.
Of course.
It's like in the past I already worked with medical interpretation, like in English and in Portuguese.
Mm-hmm.
And sometimes I already had the situations with the professional using some complex word. And it's like me there I needed to understand, okay, I got in English, I understand. But like when I'm going to communicate to the patient and they should interpret that in another language, it's like I'm not interpreting just one word. I mean, like, push a whole sentence paragraph to explain to the patient what the doctor, like, okay, he said this word here. And like, okay, so the patient, okay, I understand. Yeah, I agree. Yeah, I want this treatment. But like, if you are not there advocate for the patient and helping, it is like they are lost, like, or they don't make the decision. And you see cases like that, the patient refuses the treatment because they don't understand. It's so confusing. I'll say no when it would be beneficial for them.
Yeah, absolutely. That's a really good point. And, and I think part of the problem too is that when you're dealing in health, your own health or the health of your family, you're often anxious, distraught, confused, upset, and our emotions either help or hinder our ability to read and understand information. So then if you throw complexity on top of those emotions, it makes it much harder. And I hadn't thought about it the way you just said, but I agree. We'll often say no simply because we don't understand, not because no is in our best interest.
Yeah. Well, I think, there's so many cases. I guess we can talk about many cases here and the stories. Well, another thing that you kind of like, well, it's not really, I think it's related to communication. I think, there is plain language and there is a communication piece of healthcare professionals with patients, right? But one thing that irritates me in some situations, not just much with me, but I see that in loved ones. It's like the doctors sometimes, I know, to treat a condition, there is option A or option B. So many times I see, especially if they judge, I don't know, the educational level of the patient, they just present the patient with the option A, that it's what they think that's the best. They don't present the B, C, that like, hey, we have A, B, C. And I highly recommend option A because of that. There is not that explanation. So sometimes you are going to find out another option B or C down the line when you are already in the middle of the treatment.
Yeah.
And I'll let her be. That's one of the things that irritates me. Go in the part of the communication.
Yes.
But another question. Well, let's get back to plain language. And I think like we talked, plain language goes beyond than just the the readability of the piece, right, of the material. But like how does readability readability of the material and the plain language related? How they related with each other?
You're asking me how readability and plain language relate to each other?
Yes, that's my question.
Okay, well, I mean, I think in a way, I could talk about this for a long time. I think readability is the wrong word because you can read something and not understand it. I think it's really understandability rather than readability. So, for example, I took Spanish in college. I can read it, I can pronounce it reasonably well, but I don't understand it. So I think, and then the problem also gets, then people want to use all these readability, online readability or readability software. It says 8th grade. And I explain to my clients that that will only really tell you how many words per sentence and how many syllables per word, with the assumption that the longer the word, the more difficult it is to read. So, for example, the word television, 4 syllables, would score probably at least at a high school level. But I think people, even who don't speak English, know what the word television means.
Yeah.
But the word ennui, which means boredom, is 2 syllables. That would score at maybe the 2nd grade, 3rd grade, and a lot of people have no idea what the word ennui means. So, and I asked someone in the plain language field who had written about this, and she said that you can use readability tests to show that something's complex. So if it scores at the 22nd grade, obviously there's a lot wrong in that content. But you can't really show that if now that it's scores at the 8th grade level, that everyone who's gotten through the 8th grade is going to be able to understand it. And so I tend to use it as a way to get into a company or an agency by showing that the complexity of what they have created to begin with. But I advocate for user testing to show that the revisions are much clearer than the original. So in other words, user testing is a far better measure of how well or how poorly someone can understand information that you've written. Well, not the person can understand it, but that the information is understandable. However, every single company or agency I've ever worked with wanted numbers. So, sometimes you have to be practical even when you know what the problems are. And I always explain to them what the issue is, and they always say, well, that's okay, we want to score anyway. So I give it to them.
I think I got the point.
Yeah.
I think it's important to have the readability level, like I said, 5th grade, 8th grade. But I think definitely it is important to know who is your audience, right? And what is the experience that your audience is going, what they're having.
Yeah, it's not just 8th grade. 8th grade is not the same for everyone, right? It depends on multiple contexts. But, corporations and the government, they like numbers. So there you go.
Yeah. I think that, unfortunately.
That's a hard one to get people to understand, that they're not really getting what they think they're getting. But in any case, we know it's better once we've revised it than the original. So, we know we've created something that's a lot more understandable.
Yeah, I understand. I think the government has its complexity to cause a change, but I think in terms of private companies, maybe private organization, I guess that's a consideration. I think that they should have, right? It's like, okay, if you really want to communicate well with your target audience, with your patients, I think in terms of healthcare organizations. Like I work a lot with health techs. If you are selling to direct to consumers, direct to the patients, and you really care that they're going to understand the solution you're providing, all that, it's like, okay, interact with them, get your feedback from them.
Absolutely, yeah.
Um,
Or things like, hospital, I can't think of what it's called, but it's the papers they give you when you're being released from the hospital. There's supposed to be instructions on what you do when you get home,
yeah.
but
For
really,
discharge papers.
yeah, they're really more for the hospital, not for the patient themselves to know what to do. And so anyway,
Yeah,
I,
yeah.
those papers are really very frustrating to me because once you leave the hospital, there's no one there to explain what it means, right? So you depend on the information that they're giving you to be understandable. And if it isn't, then you call, and then maybe your doctor responds, maybe they don't, the hospital. So wasted time, wasted money,
Yeah.
frustration, and people may not take their medication correctly. They may not do the exercises they need to do. It can accelerate the problem rather than solving the health problem.
Yeah, yeah, and I think, yeah, I had not thought about the part of the papers, but I think like in the whole context, like they, let's say they are being discharged from the emergency room, and it's like there's such a whole emotional stress.
Yeah.
It is like, okay, how much well you are going to pay attention to the recommendation, have capacity to pay attention on the directions of the doctors. And it's like I said, if the discharge papers are not that clear, it's like, yeah, like I said, people are not going to follow much the directions. So don't go, maybe do for 2-3 days, and then don't do for the 9-10 days sometimes that they need to follow those recommendations.
Or, in some cultures, and often just because people prefer it, well, let me start over again. Translation can be an issue too. So suppose my parents don't speak English, and I'm a freshman in college, and I speak English, so I go in with them when they go to the doctor, and then the doctor or the PA or the nurse, whomever, tells me what they need to do, but not in a way that I can particularly understand it. And then I have to try to translate it from English back to the language of origin. And so then that becomes another layer of complexity. Or you read it and then you take it home, and then you have to explain it to someone else in the family. And so, it's not just about the person sitting in the office with the physician or the person being released from the hospital. It's also, how does that complex language keep the entire family or friends or whomever from understanding what the problem is with someone they love and care for. So
yeah, absolutely, yeah, that's
very
true.
complicated. It's not just the one-to-one, I don't understand what the doctor's saying. I think it goes farther than just that.
Absolutely, yeah, absolutely. I think, you brought me, that's definitely, like I said, you work with interpretation. You go into this situation because it is, and you need to translate when or you are going to interpret. If you are translating the paper, you need to interpret that. You need to put in language, use words that are easier to understand for the culture, and especially when they use expressions that make sense in American culture. But okay, how do I communicate for someone from Portugal, for someone from Brazil? So I needed to make that easier. And I think like you said, in terms of the whole communication, it is not just the patient themselves. Like I said, there is the family, there are the caregivers. And then we are going to go back to the part of look your audience. It is like if your patient is a senior, it's an older person, very likely they are not the only one to, especially in advanced age, they are not the only one to taking care of themselves. They are going to have family members, caregivers, and so it becomes really crucial to understand the communication of that caregiver. And sometimes the caregiver does not go to the consultation. They are not in the visit with the patient for some reason.
Yeah.
All that. So like, hey, then it makes a lot more important, right, to have that material. Well, not just that material. I think like if they could point it out to other resources online or apps, all that, where the patient, the caregiver can get the information instead of Google. Because like if you push on Google, then you have the whole dangers of misinformation. Or but yeah, that's a whole other thing. I guess if we go into the part of misinformation in plain language. Okay, so I have a couple other questions, even though there are some stuff that we are talking that are going together here. How, I think you already answered that in other ways, but I'll put the question. How does plain language impact access to healthcare services?
Well, I'm glad you even mentioned the word access, because access to me is not, sometimes people talk about access as if it is only related to ADA, or Americans with Disabilities Act, where you have to present information so that people who are deaf will be able to read the captions, or people who have vision problems will be able to see or read or hear the information. But I think of access as something for all of us, that if we don't understand the information that we're given about our health, then we don't completely have access to health care. So health care is not just the physician or the nurse or the healthcare workers. It's not just the interaction that you have. It's the information, it's the content, it's the crucial access that you need to instructions on how to do X or Y, or what medications to take, or what symptoms to look for. And so I think access and plain language go hand in hand. And that is, I think, one of the goals of plain language is to give as many people as possible access to information that will affect their lives. And to me also, access means not just having the information, but understanding the information, which means the writer has to create the information in a manner that is easy to understand so that people have access to it. Like, try understanding Medicare does a pretty good job, but there are insurance agencies that give you information that's very difficult to understand, and yet you're dependent upon them to pay for part of your health care. So anyway, it's a wide problem, but access to me means people can get it and they can understand it when they get it. And I just want to make one more point about that, and that is that a lot of companies, healthcare obviously included, like to talk about transparency, and we're very transparent about X, Y, and Z. Transparent just means I've given you the information. Transparent doesn't mean you necessarily can understand it. So when a company or an agency says to me, well, we try to be very transparent, I always say, all right, but how clear are you? Clarity and transparency are not the same thing. So anyway,
just
throw that in there.
That's a great question. That's a great question. That's a great point. My husband is he's a disabled veteran, and so he uses the VA system, right?
Yes.
And like it's so many stuff of the government, like I said, they use, oh yes, we are transparency, and you can find all the information, you can find all the healthy data, so many stuff. You can find that available. It's out there. The thing is, go find it. The whole website is a real maze of information.
Yeah, exactly.
And like I was digging through, and sometimes sometimes I go dig through like my husband is going to do some treatment, or the doctor recommended that, or referred them to certain facility. I'm the person that's going to go there and I check, okay, what are the scores, what's the star rate of the facility, what's the score there. But it's not easy for you to find this information.
Right.
And it's a whole maze. You spend so much time to find this information. But like you said, if you ask, oh yeah, we are transparent, the information is there. But like go jump through so many hoops of it, 200 pages websites, maybe in the page 198, you are going to find the information.
Yes.
And Yeah, go
Yeah,
ahead.
I didn't mention that. Yeah, you're absolutely right that access is also the ability to easily find the information you're looking,
Exactly.
right? So to
Exactly.
find it, understand it, and use it are sort of the three, pillars, I guess I'll say, of plain language. Is it easy to find? Is it easy to understand? Is it easy to use? And
Yeah,
and
absolutely.
let's just do that, and it will solve all our problems here.
Exactly. And I mean, like, I understand it. I don't know,
Yeah, if I
but
can
like,
find it.
yeah, and then, like, I understand that he, like, for, let's say, for a large healthcare system, with patients that they are treated with different chronic conditions, different illness, it is complex to put all this information, this library information in our website. It is going to become so many pages you are going to have in the website, correct? But and that's the part when if you can provide a more individualized, personalized type of care to the patient and the communication, like we are talking more clear, you are going to say, hey, my patient has, for example, diabetes, and they really struggle and they needed to manage their condition, and they also have a high blood pressure. Okay, there are these two resources here, there are these two links, go there. You don't
Yeah,
need it just like, here's the main website, here's the main library. Good luck. And what pretty much I think so many healthcare institutions, that's all that they do. It's like,
yeah,
okay, yeah, we have the resource. Like, good luck, go there, find the information.
yeah,
And then people are going to complain about like, oh, because the patient is so misinformed, or they make it, how, and that's the whole part we are going to get. We are going to get on how do we really help patients to make informed health decisions,
right.
right? I think that's one of the main questions. Beyond the plain language plays it's a great tool to help with that, right? But like if you just put the information, you create the resources and say, good luck, go find it. The people, the patients are going to find it elsewhere. They're going to get misinformed, get confused information. And like you said, don't follow that treatment or add all the stuff that in their treatment medication they shouldn't. And then the healthcare system, the healthcare provider is going to question, oh, why the patient is misinformed? How are you? I don't think that question should be just or just criticize the whole misinformation. Yes, we need to combat health misinformation. But like, what can we do? What are we doing right now, right? How can we
Yeah,
improve on that?
yeah, exactly, exactly. And health information, usually I don't look anything up unless I really need to know it. And if I need to know it, I want to find it right away. So, I always wonder why a healthcare facility or insurance or providers, why they don't not only write information in plain language, but then use it as a branding opportunity so that I could say to my friends, I go to Dr. Taylor because every time they talk to me or everything they give me is easy to understand. Now,
Yeah,
wouldn't that make you want to go to that doctor?
exactly. Yeah,
So
exactly.
I think there are opportunities that the agencies or the providers themselves are not recognizing. Plus all the money and time that is saved because they don't have to respond to a myriad of questions because the patient understands the information. So
Yeah.
anyway, the other thing that happens to me a lot is I'll have companies say, well, let's say we're looking at a privacy policy. They'll say, well, people don't read anyway. And then I always say, we don't read these things because they're so awful. We've been trained to know we're never going to understand it.
Yeah,
So
that's right.
sometimes or if you look at what you get with drugs, the fold out thing that's
Oh yeah,
five,
yeah.
no one reads that because they have to provide it, but I don't have access to understand it, and so then it just gets tossed away. And
Yeah, yeah.
trees are losing their lives over this paper.
Exactly. Yeah, that's another. Yeah, all those papers of the medications. It
Yeah,
is. I think like, hey, you could provide some online resources on it would be easier and more
yeah,
visual, a lot more easy to understand. when I was young, I used to read a lot because I have a allergic reaction to some medications. So I'm a different person that used to read all that to check.
Yeah.
But like today I don't. But it is, I know, like all the adverse reactions, all that. But like I said, it's complex because then you are not going to find simple words, and you still need a dictionary on your side of
Yeah.
medical terms to understand. Yeah, it's
Or,
still, yeah, we need to improve on that.
or, in a situation like that where probably by law they have to give you all that information, maybe they could start with just a plain language summary. Plain language
Yeah.
summaries are getting to be a thing for science and drug companies because the EU requires that, in this case, privacy policies be written in plain language. So any company that does business with the EU has to write their privacy policy in plain language. So, regulations can help move us in that direction as well. I was going to say something else and forgot it. So,
But maybe you remember later. Yeah, that happens. With me happens.
of course, of course.
Another question, like we were talking about, bring it to the part of AI and the whole new innovation technology, AI, generative AI. How would you say, in your opinion, what in your view, what is the impact that AI or generative AI can have on plain language?
Well, I think that gets really complicated because I think in some cases AI can be used to generate like what I would call a first draft, but it depends on. I would be very reluctant to use it in a healthcare situation unless I had an expert both in the health field and in plain language reading that generated material for accuracy, for tone. So there's that. I think there are a lot of companies that are going to assume or try to use AI and remove the human from the process,
Yeah.
which I think would be a terrible mistake. And then the other issue is I heard a phrase, someone called it prompt engineering. Garbage in, garbage out. You've got to know exactly what prompts to give AI in order to generate the content that you want. And not all, there aren't a lot of people trained to create those prompts. So I think it is going to be effectively used when it's used by people who are experts in the content. Then I think you can use it again, as I said, just a first draft. But I would never encourage anyone to generate something using AI without human eyes reading, thinking, and understanding.
I see. Yeah, makes sense. Yeah, makes sense. Yeah, I think you should need that human supervision, and like I said, especially in the healthcare and the medical space.
Especially in healthcare, yeah, because again, I don't, maybe it's that thing where, well, did we trust the internet when it first came out? Did we trust Google when it first came out?
Yeah.
So any technology is going to get pluses and minuses, but I think we're just at the beginning of AI. And so for the beginning, I would say don't trust AI to know everything.
I see. Yeah, rich man. I agree. To that way. That's true. Yeah.
Yeah.
All right. Okay. I have two last questions. One, it's what are some of going to your organization? What are some of the resources that the plain language group offers? What are some of the resources you offer to your clients?
So we revised content, obviously, in print and online. We conduct usability tests. I personally have acted as an expert witness in a number of lawsuits that had to do with whether or not information would be understandable. We do research or analysis of documents. So I think we provide a wide range, and then of course we try to combine them. So whenever whenever we're working with someone, with a company to revise their content, we strongly urge them to do usability testing on it. Or when I'm testifying in court over the understandability, again, I can support my position with user testing. We do design work as well. So I think we offer a wide range of resources on our website, by the way, which is theplainlanguagegroup.com. We do offer a checklist that anyone can download to be used as kind of a reminder of plain language strategies, particularly for people who've gone through training but need reminders of all the various strategies for plain language. So that's available on our website. But yeah, I would say that we do almost all the activities that would be easily associated with being a plain language agency.
All right, that's awesome. Okay, that's great. I'll put I'll definitely, when I post our episode in the air, I'm going to put the information, I'm going to put the link to your website so people can reach out to you. And I'm going to put your link for your LinkedIn too, so like people.
Yes. My email, my LinkedIn, and the website would be helpful.
And all right, so my last question. Okay. I really enjoyed the conversation. What's the biggest takeaway that you hope your listeners can learn from our conversation?
That the use of plain language in health communication can literally save lives. So that would be first. The second is that the use of plain language in health communications can decrease frustration, misunderstandings, and help all of us actually lead healthier lives because we understand how to do that.
I see. Yeah.
So just, and I think here's one more thing I will say. We really need people to advocate for the use of plain language themselves. So if you're in your doctor's office and they use vocabulary you don't understand, don't pretend that you understand it. Ask them to explain it to you in plain language. In other words, as the patient, let's try to convince, or let's push our health caregivers to the kind of language that you or I would understand, or people who are not in the health field would understand. So, stand up for ourselves for the use of language.
Yeah, absolutely. Yeah, that's a great point. I think, patients need to be their best advocates and and challenge the healthcare professionals, right, to do better in their communication.
Exactly. I did a TED talk called "Demand to Understand," and I tried to make exactly that same point, that in any situation, health, finance, we want to be our best advocates for plain language. It can't just be the experts like you or like I, you or me. It also needs to be the people who are affected by the use of or the lack of plain language. So power to the people and power to plain language.
Yeah, we need that. We need not to, I think it's encouraging healthcare professionals, healthcare organizations, how to make a change for their patients and communicate with their patients, but also encourage the patients, right, to help them and to have the tools and advocate for themselves.
Absolutely.
All right, thanks so much, Deborah, for joining me. I really loved our conversation, and I
enjoyed it tremendously. Thank you.
Thanks so much. Thanks so much for joining.
Have a good rest of the day.
You too. Bye-bye.